Dear students, good day. Today we will talk about the breast cancer. Here is the plan of our lecture. First is epidemiology, types of breast cancer, signs and symptoms, causes, type of primary breast cancer and diagnosis, risk and prevention. Over 75% of women who are diagnosed with a breast cancer are age 50 or older. The 5-year relative survival rate is now 98% for women with a breast cancer caught before it spreads beyond the breast. Breast cancer incidence is greater in women of highest socio-economic background. The relationship of breast cancer risk with socio-economic factors is most likely related to lifestyle differences like number of pregnancies and age at first childbirth. About 90% of breast cancers are due to genetic abnormalities that happen as a result of the aging process and life in general, not to inherited mutation. So about the risk factors. The most significant risk factors for breast cancer include gender, being female, and age, growing older. Factors with minimal or no risk include fertility treatment, abortion, deodorant, and folic acid. Short-term use of hormones for treatment for menopausal symptoms appears to confer little or no breast cancer risk. Although men can get the breast cancer, women's breast cells are constantly changing and growing, mainly due to the activity of the female hormones estrogen and progesterone. This activity put them at much greater risk for breast cancer. Hereditary breast cancer. The name BRCA1 and BRCA2 stands for breast cancer susceptibility gene 1 and breast cancer susceptibility gene 2 respectively. Most breast and ovarian cancer occur in a woman over the age of 50. Women with harmful BRCA1 or BRCA2 mutation often develop breast or ovarian cancer before age 50. A woman has inherited a harmful mutation in BRCA1 and BRCA2 is about 5 times more likely to develop breast cancer than a woman who does not have such mutation. Regardless, women who have a relative with a harmful BRCA1 or BRCA2 mutation and women who appear to be at increased risk of breast and or ovarian cancer because of their family history should consider genetic counseling to learn more about their potential risks and about BRCA1 and BRCA2 genetic tests. Male breast cancer, pancreatic cancer, and prostate cancer appear to be most strongly associated with BRCA2 gene mutations. So, mutation in several other genes have been associated with genital breast and or ovarian cancer. So, less than 1% of all new breast cancer cases occur in a man. Men with a BRCA1 mutation have a 1% risk of developing breast cancer by age 70. BRCA2 mutation confer a 6% risk. Breast cancer prognosis, even in a stage 1 cases, is worse in a man than a woman. So, treatment for males breast cancer has usually been a mastectomy, which will be followed by radiation, hormonal therapy such as tamoxifen, and chemotherapy. So, according to the American Cancer Society, about 60,000 cases of ductal invasive carcinoma are diagnosed in the United States each year, accounting for about 1 out of every 5 new breast cancer cases. There are 2 main reasons this number is so large and has been increasing over time. So people are living much longer lives. As we grow older, our risk of breast cancer increases. So, and more people are getting mammograms, and quality of the mammograms has improved. With the better screening, more cancer are being spotted early. So, signs to watch out: a lump felt in the breast, an inverted nipple, nipple discharge, clear or bloody, nipple pain, sores on the nipple and areola, enlarged lymph nodes under the nipple. So, about the signs and symptoms of the breast cancer, discuss inflammatory breast cancer to highlight the unique presentation of particular aggressive form of breast cancer. Other conditions have symptoms resembling those of inflammatory breast cancer. A breast infection, mastitis, also causes redness, swelling and pain, but breast infections usually develop during breastfeeding. With an infection, you are likely to have a fever, which is unusual but not unheard of. In inflammatory breast cancer, breast surgery of radiation or radiation therapy may block the lymphatic vessels in the breast skin, temporarily making the breast swell and become discolored. So, when caused by surgery or radiation treatment, however, these changes gradually subside. So here is the most common thickening lump or thickening, often painless, discharge or bleeding, change in size or contours of breast, inversion of the nipple, change in color or appearance of areola, and redness and pitting of skin over the breast, like skin of an orange. So, non-cancerous conditions include fibrocystic changes, slumpiness, thickening, and swelling, often associated with a woman's period. These fluid-filled lumps can range from very tiny to about the size of an egg. Fibroadenomas, a solid, round, rubbery lump that moves under skin when touched, occur in mass in young women. And infections, the breast will be likely be red, warm, tender, and lumpy. Trauma, a blow to breast or a bruise can cause a lump. Microcalcifications, tiny deposits of calcium can appear anywhere in the breast and often show up on a mammogram. Most women have one or more areas of microcalcifications of various size. Majority of calcium deposits are harmless. A small percentage may be precancerous or cancer. Biopsy is sometimes recommended. Some of the cells begin growing abnormally. These cells divide more rapidly than healthy cells do and may spread through the breast to the lymph or to other parts of the body, so metastasize. The most common type of breast cancer begins at the milk production ducts, but cancer may also occur in the lobules or in the other breast tissue. So here you can see the normal breast profile. Here the ducts, lobules, dilated section of duct to hold milk, nipple, fat, pectoralis major muscle, chest wall, rib, and enlargement, normal duct cells, basement membrane, duct wall, and lumen. And during breast, a ductal carcinoma in situ. So you can see carcinoma refers to any cancer that begins in the skin or the tissues that cover internal organs. So you can see in the ductus, the ductal cancer cells. So here is the wall of the duct and ductal carcinoma in situ. The cancer has spread to surrounding tissue. It's invasive ductal carcinoma. It's about 80% of all breast cancers. So the range of ductal carcinoma in sero, normal cells, begin ductal hyperplasia. It leads to atypical ductal hyperplasia, and ductal carcinoma in situ with microinvasion and invasive ductal cancer. Invasive lobular carcinoma, you can see normal lobule and lobular carcinoma in situ. Lobular cancer cells breaking through the wall. Cancer can also invade lymph or blood vessels. So you can see how the cancer cells invade the lymph duct, and cancer cell in the blood vessels. And inflammatory breast cancer, unlike ductal or lobular breast cancer, is usually not detected until after it has reached a more advanced stage of development. It is treated first with chemotherapy and then with surgery, which is exactly the reverse order in which ductal and lobular cancers are typically treated. So I will not read all this information from this slide. And about the types of primary breast cancer: non-invasive breast cancer, ductal carcinoma in situ, and invasive breast cancer. So non-invasive breast cancer has not yet developed the ability to spread either within the breast or to another part of the body, and ductal carcinoma in situ is an early type of breast cancer, sometimes called intraductal, non-invasive, or pre-invasive cancer. The cancer cells are inside the milk ducts known as in situ and have not yet developed the ability to spread either through the ducts into surrounding breast tissue or to other parts of the body. If ductal carcinoma in situ is not treated, the cells may develop the ability to spread and become invasive breast cancer. And the last one type, it's invasive breast cancer. It's most breast cancer are invasive. But invasive breast cancer has the potential to spread to other areas of the body. This doesn't mean the cancer will spread to another part, just that it's possibility. Treatment aim to reduce the risk of this happening. So invasive cancer, ductal breast cancer, if no special type. Most breast cancer are invasive ductal breast cancers. Breast cancer cells start in the milk ducts and have spread to the surrounding breast tissue. It's also called breast cancers, no special type. Invasive lobular breast cancer, this is the second most common type of the breast cancer, where the cancer cells in the lobules, milk producing glands, have spread into the surrounding breast tissue. And Paget's disease of the breast, it's an uncommon type of the breast cancer that causes changes to the skin of the nipple similar to eczema. And as the types of the breast cancer, there are several other rare special types of the breast cancer that includes tubular, cribriform, mucinous, medullary, papillary, micropapillary, malignant pilots, and metaplastic. So here you can see the TNM staging of breast cancer according to stages, from 0 stage to 4 stage according to TNM classification. And here the more simple picture, tumor size less than 2 centimeters, it concerns to T1 stage, from 2 to 5 centimeters T2, more than 5 centimeters it means T3 stage, and if the tumor extends to skin or chest wall, it is the T4 stage. So breast cancer screening and prevention. is surveillance mammography, sonogram, MRI, clinical and self-breast examination. Chemo prevention, tamoxifen, raloxifene, prophylactic surgery, bilateral prophylactic mastectomy is made Angelina Jolie, and oophorectomy. So mammograms for low-income women and the uninsured. So mammograms are usually covered by health insurance for women. There is for United States. And conventional treatment, it includes surgery, chemotherapy, hormonal therapy, radiation. Just over the horizon, breast cancer vaccines trials are under the way with vaccines like Pneumovax, which stimulates anti-HER2 immune response, and Stimovax, moving into phase 3 trials. So, triple-negative breast cancer is clinically characterized by the lack of expression of estrogen, progesterone, and HER2 hormone receptors. Is the most harmful breast cancer type of breast cancer. Next, the breast cancer experience. From the very instant you receive patient receive diagnosis, of breast cancer until they take their very last breath of life, they are survivor. Once a woman is diagnosed with a breast cancer, the initial news and subsequent treatment regimens, which are often difficult physically and emotionally, will transform her life and the life of loved ones and friends around her. So, how to reduce your risk? Limit alcohol, don't smoke, control your weight, be physically active, and breastfeed. Thank you for your attention.